Okay, since I used a non-water-based brushless scrub, I don't need the towel that's sitting on the top of my gown. And my gloves really aren't on top of that towel there, so I really don't want to get close to them at all. And I really want to make sure that I don't reach around the edge of my gown as well. So I'm going to grab the gown and the towel at the same time, making sure that those gloves fall off, getting rid of the towel, either handing it to someone who's unsterile or tossing it off, making sure that I stay a safe distance away from them. Open the gown, making sure that I don't bring my arms in and touch my scrubs. Come in with one arm, come down to my belly, come in with the other arm and come down to my belly. Then your circulator will come in and tie you. You can kind of tuck your cuff as you approach the field to grab your gloves. Remember that your hands cannot come into that white cuff on the gown until your hand comes through with the glove on top of it already. Okay, pick up your gloves. Remember that you don't want to shift your wrapper in any way because you've already established where your sterile levels are. Position it so that the fingers are facing towards your belly and the thumb is down. Then grab your ridges, flip it over, tuck your hand inside, making sure that your hands aren't too low and also that they're not too high up near your mask. Grab your second glove. Again, position the same with the thumb down, the fingers towards your belly. Slide that on. Your circulating nurse, you can ask them to get rid of your trash on your Mayo stand. And they will also help you with spinning your gown before you approach the back table to put on your second pair of gloves. Hand them the cards so that you face the sterile field and they come around the back side of you. The wrapper's good. Okay, thank you. Don your second pair of gloves. Okay. And then we'll start to get our items on. So when you get your items on, you need to make sure that you start on the outside and work your way in so that you don't get yourself between sterile fields. So you can start with either the suction irrigator on that side or the instrument set on this side. Okay, so the instrument set is really the priority over the other items, so we want to make sure that we get that on. Now, it's very close to this video, Tari, so you could always ask your circulating nurse to move it for you so that you're not too close to other items. Thank you. We're looking for 2 indicators on the inside. I can see that one there and that one in that corner. Sometimes people will use these long laparoscopic instruments and reach down inside to flip them over. Now, make sure that you come in with your hands this way so that you don't get too close to the edge on the instrument pan here. You're going to pick up the pan and wait while the circulating nurse checks both the filters on the bottom. You're good. Okay. And then place that on the edge of your back table that's going to be furthest away when you pull up to the field. So let's do the scope next. Thank you. So you're going to pull the lid off the scope and hand that to your circulating nurse. You're going to look inside. There should be 2 indicators again. Make sure that both of those have passed, making sure you don't get too close with the front of your gown. Pick that up. Ask the circulating nurse to check the wrapper on the bottom. Wait while they check that before you put this over the field. You're good. Set this down on the back table. There may be some adapters on the inside that you need to put onto the scope in order for the light cord to fit. And we always want to double check and make sure that the light cord fits the scope at this point in case we need to call for another one. So this fits. So I'm going to keep both of those items and then hand off this tray. You can pick up the basin over here. We're going to place it opposite the instrument basket. And then we'll get these items on over here as well. Now, the suction irrigator, you can't always ask somebody to hold it if you feel like you can't get to it without touching these laminated edges here. Because remember that those items, or those edges, can contaminate your item. Can you grab that? Thank you. And remember that this piece that goes into the bag often is stuck in the container. So, and then your circulating nurse is going to check that for you. Good. Before you put it over onto your back table. Now this is going to be in the bottom of your basin, so you can just go ahead and stick it there rather than moving items multiple times, putting it on your back table. All right, your camera sometimes is wrapped in a towel, so you want to open that towel up, look at the indicators on the inside, pick it up, and wait while your circulating nurse checks that wrapper. Good. Okay. Thank you. And then you can place it on your back table. All right. So we have several things that we can do here on the back table. Most people will try to get all their cords contained because they do take up a lot of space here on the back table. So you can pull this insert out of your instrument basket and put it back here so that you can get to your pottery here, because we want to stack our cords inside our instrument basket in the order in which they're going to be attached to the field, which is the order in which they're going to be utilized during the case. So on the bottom, we want to have our suction irrigator, which we already have in there. And we're going to have our pottery cord. Then we have our camera and our light cord, which work together, so it doesn't matter which one is on top. You're going to have your insufflation tubing here, and then you can grab your light handles as well. So we want to have the things stacked in the order so that what's on top is what's used first, which is going to be your insufflation tubing. Okay, so insufflation tubing, camera light cord, cautery, and your suction irrigator on the bottom. Then we're going to start to organize the contents of the pack here. So you're going to have a gown and gloves and a towel for your surgeon and their assistant. So again, remember, you want to have minimal movements around the back table. So if you touch something, you want to make sure that you do something with it. Okay, so we're going to have the towel, the gown, and then the gloves. Same thing for your surgeon. Now, there isn't a lot of space behind the instrument basket on this one, so you're going to probably have to just kind of put it beside the instrument basket here. Okay, we're going to drape the Mayo stand. So open up the Mayo cover, it has right hand, left hand here. You're going to grab all the layers on the inside. Make a large opening for yourself. Approach the Mayo stand, put your foot on. Start to slide that on. Now if you want to use the belly up method, you bring your belly right up to the Mayo stand and then just continue to slide that Mayo cover on, making sure that this doesn't flip up too high and touch you at an unsterile level on your gown. Once it's draped, bring it up to the back table. We're going to place 2 towels, making sure that the overlap is to the back edge of the Mayo stand, what will be closest to the patient's feet. And then your suture bag will go on the Mayo on the full edge where you're going to stand. Okay, we need 3 towels for the back table here. We're going to need 4 towels with the drape that we'll drape with. So this is a LapChole sheet, and then those 4 towels, and we're going to set those on top of the cords that have been prepared inside that basin. Make sure that they're not going to fall over. You may need to stack your towels beside each other, and also make sure that they're not hanging too far down. Any extra towels that you might have, if you have room behind the instrument basket, you can try to put them back there, or you can also put them beside the gowns as well. All right, open 2 towels on the back table. One on the edge that's going to be closest to the field when pulled up, and then another one more in the middle. And then make a roll towel. Okay, organize the contents of the basin. So pull out all the items. The scope warmer can go ahead and go up onto the Mayo stand. Okay, emesis basin, other basins here, your med cup, open your needle book. And you can just leave that on the back table for this one. Your knife protector goes up on the Mayo stand. On the edge that's going to be furthest away from where you stand. Remember, we always keep our sharps on the edge that's furthest away, so that we don't end up poking ourselves. You can put your defogger and the sponge up onto the Mayo as well. You're going to put your suture in order of use. So I have a 3/0 absorbable on a cutting needle, which will be my skin, and then I have my O absorbable on a taper, which will be my muscle fascia. So that will be on the top. And then I have my suture that I just opened when we were preparing. Once you have those items organized, you're going to grab the ringed instruments out of the instrument basket. Place those onto the roll towel. Just like on the other setup, we want to have the smallest ringed instruments closest to the small counted items. That way if we ended up having to do an instrument count, these are the items that we would start with. Put the instrument stringer underneath the instrument basket. You can put the scope up on the Mayo stand, and we're going to go ahead and put that in the warmer. Remember that you usually pop your warmer about when your patient comes in the room in order to get it ready to use during the case. Remember that you need to throw your indicators away at some point as you're setting up so that they don't go back through sterile processing, and you're going to throw them away in your suture bag on your Mayo stand. Okay, we're then going to organize everything else that's in the instrument basket here. So I have a knife handle, which is going to come over here. I have some forceps here, organized in pairs. And then I also have a few retractors here. Not going to have as many in a LapChole set as you do in a laparotomy set, of course, but just have those organized. That way if I needed to pull them out or use them during the case, they're organized. All right, then we're going to do an instrument or a count, but first, if your circulating nurse is ready, they're going to go ahead and give you these other items, disposable items that we identified were going to be opened. So this is your endo shear. So make sure when you pull this out, you use 2 hands so it doesn't go over the laminated edge. A lot of times it's stuck inside that plastic. And then you wait while they verify the integrity of that packaging material before you put it on the field. Okay, the endo shear can just go directly up onto the Mayo stand because that's where it's going to be. The trocars, as you pull them out, you want to assemble them, putting the obturator on the inside, and then also closing off the stopcock. We'll place those up onto the Mayo stand as well. Good. Good. Okay, so you're going to have 2 11 trocars and 2 5 trocars. Good. Okay, putting them together, and then the stopcock is off when it's at a right angle to the opening. So this would be open, and then this is going to be shut off or closed. Okay. We have a Very's needle here. So this has a couple of pieces with it. So make sure when you pull that out, you don't allow any portion to go over that laminated edge. That goes together by screwing that on at the top. Okay, and that of course will be the first thing that's going to be utilized. And then we have our clip applier here, which you're going to pull out, wait while the integrity of that package is checked, and then you place that up onto the Mayo stand as well. Okay, I'm ready to do a count if you're ready. So remember, for laparoscopic cases, we don't do a full count of instruments unless it's scheduled as possible open. Counts are usually required when your incision is larger than 2 inches, which it won't be for our trocars here. Okay, so we're still going to count in the same order as we did before. So sponges, I have Ratex, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Atraumatic needles, remember if you have a package that's closed where you can't see the needle, you need to make sure that you open that up, and you need to make sure that you use something besides your finger to point to the needle. So I have 1, there's 2, 3. I have 1 suture in here as well, which is 4. And then your sharps are going to be just your hypo needle and your blade, so I have 1 and 2. And that's it. Thank you. All right, so on the Mayo stand, we want to make sure that the tips of the laparoscopic instruments are closest to you, which you're going to be standing here, and the handles are going to be furthest away. That way you can see the tips to identify the instruments better, and also they're going to be oriented so you can just pick them up and hand them to the surgeon, because the surgeon's going to be standing across from you. So there are some surgical techs who prefer to use a roll towel on the Mayo stand for the laparoscopic instruments, so I'll just show you how to do that. You don't have to use one if you don't like it, but you can just make a small roll towel, and use that to kind of keep those laparoscopic instruments positioned up on the Mayo. So we want to put those laparoscopic instruments in the order in which they're going to be utilized during the case as well, and we'll talk about that here in a minute. Okay, go ahead and load your knife. So we have a 15 blade. Your surgeon may prefer to utilize an 11 blade as well. That's just going to be their preference. But we're going to utilize it to make those stab wounds prior to placing the trocars that we utilize on these types of cases. So load the 15 blade with a needle holder, place it inside the knife protector, again on the edge of the Mayo that's furthest away from you, so that the knife is down, or the sharp edge of the knife is down. Since I'm right here, I'm going to grab my basic ringed instruments. So we're going to grab 2 Kellys, 2 Mayos, and 2 Cokers. So we use the Kellys to kind of open up the incision. We use the Mayos to help harvest the specimen on like a lap chole. And the Cokers we use to grab onto the muscle fascia to tent it, to lift it up when we put in the Berry's needle initially. Or if your surgeon doesn't use a Berry's needle, to put in his initial trocar to make sure he doesn't put it through anything in the abdomen. These are going to go on the front edge of the Mayo, curves closest towards you. Remember, you're going to stand over here, so smallest ringed instrument closest to you curves that direction. I'm going to grab tissue forceps with teeth and go ahead and put those up there. We're going to put our suture scissor up on the Mayo as well. All right. Also, on these trocars, I did put them in order as I was receiving them onto the field. So, of course, I'm going to use my Berry's needle first. We have a 10mm scope, so I know that I can't use one of my 5mm trocars in the umbilicus, which would be next, following removal of the Berry's needle. So I have an 11mm trocar, and then oftentimes we use a mother-in-law or a claw grasper to take out the gallbladder, which is going to be through that superior port, and also I have a 10mm clip applier that we use through that port as well. So I need to have an 11mm port superiorly, so that'll be my second port that I put in. And then my 2 5mm ports will be on the patient's right side, which will house the 2 Davis and Gex that we use to retract the gallbladder and the liver. Okay, so my Berry's, my 2 11mm, and then my 2 5mm ports as well. Then we're going to grab our laparoscopic instruments that we need. So we're going to grab 2 Davis and Gex. Okay, which again, the Davis and Gex is that wavy atraumatic grasper here. So we're going to grab 2 of those. We're going to grab our 5mm blunt grasper, our Maryland, and our claw grasper. When we put those up there, we want to put them in the order in which they're going to be used. So the first thing used will be on the top, which is going to be the 2 Davis and Gex. You then have your 5mm blunt and your Maryland, which are going to be utilized to dissect out the cystic duct and also the cystic artery and vein. You then have your clip applier, which will be utilized to ligate those structures. You then have your endo shear, which is going to be utilized to cut those structures. And then you have your claw grasper, which is going to be utilized to take out the specimen at the end. So we have our 2 Davis and Gex, our 5mm blunt, and our Maryland, which can be utilized interchangeably, so they can be exchanged in order here. You have your clip applier, your endo shear, and then your claw grasper. Now, we also need to put the items up here that are going to attach to the various cords that we're going to hook up to the field. So I need to have my suction irrigator tip and my J-hook cautery as well. And those can kind of just lay at the back of the Mayo stand, because we're going to hook them up to the cords once we pull up the Mayo. And we already have our defogger up there as well. Okay. We're going to put just a couple of Ratex up there that we use those to white balance and also to blot the initial skin incisions. We're going to move our Adsons over by where we're going to load our first suture of use. So you want to have just a basic length needle holder. We're going to load that for a right-handed surgeon, so about 2/3 of the way from the tip or 1/3 of the way from the swedged end, and about, a 15 to 30 degree angle. And for a right-handed surgeon, you want the tip to come out to poke him in the nose and the suture to come out to the right side. And you can just leave that back here on your back table, because we'll just use it at the end when we go to close. Okay, so we have those items ready to go. And then you're going to get some water. So I'll take some water in my basin here.
0 water, January of 17.
Okay. And it's 500 mLs, right?
Yes.
Okay. So we're going to make a label right away. I just need one label because I'm not going to draw that water up into anything else. And make sure that you include the amount. So I have H2O, I had 500 mLs. Okay, place that on your basin. Then you're going to get your medication.
4% marking, would that be 1 to 200,000, 30 mLs?
Okay.
January 17.
Okay.
And I already drew it up.
Perfect. Thank you. Okay, remember also, if you're having a hard time remembering what the medication was, you can always ask to see the bottle again. So when you make the label, make sure that there's always a 0 before the decimal point, never a 0 after, and there's no commas when you're writing out the concentration of the epi. So you need one that has the 30 mLs on it. That is going to go onto the med cup, and then you need a second label as well that is going to go onto the syringe because we're going to draw that up. Remember that you can't abbreviate. You need to write out the entire name of the medication that you are making available. Make sure that you're not leaning over your field as you're writing your labels. Okay, when you place your syringe or the label on your syringe, make sure that it's not covering the calibration so that you can see how much was utilized during the case. Okay, draw up your medication to 10 cc's. If you have a large air bubble, you can use an instrument to have that rise to the top. Tap that out. Get rid of that air by pushing up on the syringe, making sure that it's pointed up in the air. Remember that you read the syringe by the plunger on the side, not where it has the point on the inside. Draw that up again to make sure that you're at 10 cc's, and then put on your appropriate hypo needle so that it's ready to utilize. And you can just leave that on your back. All right, then you're going to gown and glove your surgeon. If you can bring their items to the front of your back table. Good afternoon, Dr. Stallings. You're going to introduce yourself. I'm Casey Glassburn. I'm a surgical technology student at SCC.
Meet you, Casey.
Okay. When you open the gown to them, make sure that it is out away from the front of your gown and it's high enough that it's not dragging on the floor. Make sure that your hands are cuffed. Stop once you get about to their elbows. Don't come up high near their neck. Pull down their sleeves, making sure that you stay away from the white cuff on the sleeve. Glove them by knowing what their dominant hand is by reading that on their preference card. Facing the thumb towards their belly. Giving a nice cuff so that your hands are protected from their hand that's coming into the glove. They'll help on the second one. And then make sure that you don't snap the glove back against their wrist. They're going to hand you the tie. We always pull the card off, hold on to the tie so that it doesn't potentially fall off as they spin around. Then we're going to drape the patient. So we're going to bring the basin up to the field, making sure that you're far enough away from your back table before you turn your back that you're not going to back into it. Make sure also that you keep the basin far enough away from the field that it's not going to become contaminated. All right, open up a towel, make about a 2-inch fold away from you. You're going to cuff your hands, place the towel that's in front of you first. Make sure that you place it and just back your hands up. Don't open them up so that you get too close to the linen or the gown on the patient where you could potentially contaminate yourself. Again, open your next towel. Make about a 2-inch fold away from you. We're going to swing out, making sure that we isolate off any of the patient's linen or the gown, as it should not be showing on the edge where we're going to be making the incision. Again, make another towel that has the fold away from you. We're going to swing out and place that one. And then on the last one, you want the fold to go towards you, making sure that you hold it high enough that it's not going to touch anything, and make sure that you watch the front of your gown so that you're not going to run into anything that's unsterile. This is a LapChole drape, so you can see that it has a larger fenestration on it than our laparotomy sheet. It also is going to have the pouches on the side that will house all of the various tubings that we're going to attach to the field. You're You're looking for the picture of the patient. You want the head towards the head, the foot towards the foot. Ask your surgeon if they want stickies on or stickies off.
Stickies off, please.
Okay, so off means that you pull the paper off. Okay, now these you want to make sure that if you have to drop them on the floor, you would, or you can hand them to your circulating nurse. Just make sure that you watch out for anything that's unsterile and don't allow them to come back and touch you in your mask or something like that, where you're going to end up contaminating. You can always set it down too if you're struggling, if it's a very large drape. All right. Okay, so head towards the head, foot towards the foot. We're going to position that fenestration over the area we've just squared off. Open that up, stick it down because we did expose that adhesive. Make sure you watch out for this basin so that you don't accidentally contaminate it. So move it back a little bit, making sure that you keep your hand on the top edge or inside that basin. Okay, we open it up, we grab the top layer towards the foot, cuff your hand to the inside, extend out over the foot of the patient. Okay, this one happens to have arm board covers, so make sure that you open those up. Cuff your hand to the inside and extend up to anesthesia and wait while they attach it to the IV poles. We then are going to attach the various cords to the drapes. So you can hand your surgeon your light handles. We want to attach the cords in the order in which they're stacked in the basin because we want to have the first cord that's going to be utilized attached to the field first because we need to insulate the abdomen before we can do anything else. So insufflation is going to be utilized through the umbilical trocar, so we want to make sure that that's where it's positioned. You also want to look and see where your video tower is, so it's off to this side, so I want to make sure that I toss all of my cords off on this side, otherwise we're going to have a problem of plugging things in. So on this drape, you're going to have the pouch here, which is going to contain all of those cords. So we want to run this so that it will run through that pouch. And yes, oftentimes your surgeon or a PA or somebody else, even another surgical tech that's scrubbed in with you, oftentimes will kind of hold onto the cord and you can kind of use the other pouches that are on the drape to contain the cord that's going to stay on as well. Okay, then we're going to hook up our camera and our light cord. So again, those are going to be utilized through the umbilicus. Remember, it's always best to keep more on the field than to give too much away because you can always give more away, but you can't pull more back up onto the field. So my light cord here, and then my camera as well. Remember on the light cord, you're gonna know which end to keep on the field because you checked to make sure that that light cord attached to your scope, and that will also tell you which end you want to keep on the field because that's kind of confusing in the beginning when you're first starting to learn about cords and which end gets thrown off and which end is kept up on the field. All right, so camera, light cord, and insufflation tubing all utilized through the umbilicus, all positioned to use in that area. Okay, for the cautery, you want to make sure that you look and see where your cautery machine is. So it's over here on this side of my surgeon, so I want to make sure that that's where I'm going to toss it off. So cautery potentially could be utilized with any laparoscopic instrument that has a piece that sticks off the top of it. So your surgeon may be switching it out throughout the case. So we're going to toss that off this direction. And then you want to make sure, sometimes these drapes have Velcro adhesive that you can use, or you can also run them through if you have these various holes on your drape, some way that you know that it's going to be secured up here on the field. Okay, just going to keep that here. And then your suction irrigator. Remember that this portion of the suction irrigator is what's going to go off. So you actually have two cords that are going to go off. You have the one that goes to the suction canister, and then you have the portion that's going to be sterile and spike into a bag. So we need to hand both of those off, but we would never toss this on the floor because we don't want that to be contaminated. So you're just going to hand it to your circulating nurse, making sure that it's not a tangled mess before you hand that off. Okay, so your circulator is going to take that, making sure that you stay far enough away that you're not going to get contaminated. And again, we keep that up towards the head. All right, you're gonna bring your basin back to the end of your back table, and then bring in your Mayo stand. Remember, you wanna get behind the Mayo. Again, if your Mayo cover wasn't pulled down, you would wanna make sure that you ask your circulating nurse to pull that down before you pull it in over the patient. Bring your Mayo stand all the way in over the patient and always put a hand underneath to make sure that it's not resting on the patient. All right, we're then gonna attach the various items to these cords that we just attached to the field. So I have my J-hook cautery, which attaches to my cautery cord here. You can kind of put it in the pouch. I have my suction irrigator tip, which is going to attach to my suction irrigator. I have my scope, which I need to attach to my camera and also to my light cord. And remember, we want to keep that in the warmer as long as we can, up until the time of when we need to use it during the case. So the camera attaches to the top by squeezing these two buttons together, and then it fits on, and then that light cord just screws on to the side of that scope. We'll kind of just keep that down here for now. Okay. You also have your defogger, which you're going to take the cap off, squirt it onto your sponge, and then stick that on the drapes here below the umbilicus, as that's where that scope is going to be utilized. And then we're going to place a couple of Raytex up on the field to utilize for white balancing and then also for blotting of the initial skin incisions. You're then going to bring your back table up. So remember, when we move a back table, it's hands on top, not around the edge. You can kind of get it started with your foot. If you feel it starting to slide, always ask a circulating nurse to help you so that you don't end up with all of your items onto the floor. You can bring your basin out to the end of the back table as well, again making sure that it's a safe distance away. We're going to verify a timeout. Timeout?
Yes, timeout.
Timeout's good. Then you're going to hand a knife. So right hand to right hand, making sure that the blade is down. Okay, just set the knife down. You're going to pick it back up and make sure it's inside the protector. And that's when your time is going to stop. So 45 minutes from when you open the back table until you hand a knife. At that point, we're going to assume that the surgeon is closing. Okay, so they're going to have a suture and a needle holder and then the suture scissors up on the field. Okay. And then you're going to do a closing count of all of the items in the same order that we did in the very beginning. And there may be a few sponges on the floor too that you may have to count. Okay, so let's start with Raytex.
Ready to count?
Okay.
Yeah.
Remember that we always count field, Mayo, table, and then floor for each of the items that we're going to count. So I don't have any Raytex up. Okay, so I have Raytex 1, 2, 3, 4, 5, 6, 7, 8, and here's 9 and 10. Atraumatic needles, I have 1 up at the field. And then here's 2, 3, and 4. And then sharps, I have 1, and here's 2.
2.
Okay.
Okay. Count is correct.
Thank you. And then after that, you're going to identify your med and its class and action. So we had 0.25% bupivacaine with epinephrine. So you actually have 2 drugs. So bupivacaine is a local anesthetic, which is utilized for numbing or pain relief. And then you have epinephrine, which is a vasoconstrictor, which is utilized to decrease the bleeding. You're then going to tell me 5 duties that you have during the post-operative phase after the patient goes to PACU to break down the sterile field and turn over for the next case. So you could tell me things such as take care of the specimen, contain the sharps in the needle book and put them in a sharps container, put the used instruments in a basin of water, the unused instruments back into their instrument basket, put them into the case cart, mop the room, wipe everything down with disinfectant. There's about 30 different things that you could tell me, so you'll just need to tell me 5. And then you'll take off your gown and gloves, draw a number for your suture identification, which will be either for an abdominal hysterectomy, an inguinal hernia repair with mesh, a bowel resection with suture anastomosis, or a cesarean section. You will identify out of sutures that are laid out on a table, what sutures are used, in what order, and then also what procedural step they'll be utilized for. And then that will be the completion of your competency assessment.